today we are going to see about the child abuse and neglect. So, if you don't hear me, listen to me. This is the child side. And, child abuse and neglect is an international problem giving victims of all ages, races, religions, and social economic background. So, it is always called as a battered child syndrome and also called as a non-accidental injury. So, by Shobha Tandon, child abuse and neglect is defined as any interaction between them or lack of interaction between caregiver and child, resulting in non-accidental harm to the child, physical or developmental state. And Selvin in 1985 defined non-accidental injury, minimal or fatal, inflicted upon children by persons caring by them. It is an overact of commission of caretaker for physical and emotional or sexual. Child abuse is categorized as physical abuse 31.8%, educational abuse 26.3%, emotional is 23.3%, sexual abuse is 6.8%, failure to thrive is 4%, and intentional drugging and Munchausen syndrome is 1%. The history, when you look at the history, the House of Refugee movement started in the US by 19th century. In 1870, the New York Society for Prevention of Cruelty to Children, the large scale of social awakening movement started. In 1946, Caffey looked into the multiple bone fractures of children with trauma. In 1962, healthcare professionals paid large scale of attention, and Henry Kemp coined child abuse as a battered child syndrome. In 1966, the US government passed a law insisting mandatory for healthcare professionals and to report suspected cases of child abuse to the Arabs. In 1971, Montana draw attention to the word neglect, which means the parental shortcoming leading to mistreatment of children. 1972, Henry Kemp coined the Kemp Center, which is recognized to protect the abused children. In 1978, McLean coined child abuse and neglect. In the current scenario, the Indian society is aware of child abuse and neglect. And the civil authorities are well available in the toll-free number 1098. Child neglect is coined as an act of omission or failure to provide food, shelter, clothing, care, healthcare or dental care and safety need, and I might as well the supervision. And it's also divided into emotional neglect 27.8%, healthcare neglect 8.7%, physical neglect is 7.8%, safety neglect is 5.2%. When you look at the statistics, 60% cases are even not detected, and only 40% is reported. Average age detection of child abuse is 7.4 years, and reported cases in female is 51% and male is 49%. Physical abuse is more common in males and sexual abuse is more common in female. Child abuse is commonly especially seen in the tribal and remote areas. And when you look at the conditions or the factors involved is parent, children, social, cultural, religion, and stresses to the children. When you look at the types of abuse, the physical abuse is a non-accidental trauma, and below 18 years is affected. There is a difference between regional physical punishment and the legal corporal punishment. It may be mild, moderate, severe, and mild cases, you can see few bruises, welt and scratches, and moderate, numerous bruises, minor burns, and single fracture. And severe cases, large burns, serious injuries, abdominal, and multiple fractures or life-threatening injuries are there. And you can look at the pictures how the children has been treated and the physical abuse is taken care in the school and at the home level. The sexual abuse is the exploitation of a child and the sexual gratification by another person. It may be a family members or the strangers. And here the physical injury is absent, but history and examination finding will detect the orogenital contact. Sexual abuse is forcing a child to touch you or exposing some unwanted pictures and touch, good touch, bad touch, and child which is not been there is being also shown in the pictures. And emotional abuse, rejection of child by the parents, caretakers, and the teachers. And verbal abuses always affect the child's self-respect. Other forms include the psychological harm, abnormal child rearing practices, and forced confinement of the child. Emotional abuse is verbally abusing, teasing the child, and not listening to the child, and neglecting the emotional needs of the child. And failure to thrive with the child who is underweight or malnourished. Child fails to grow because of insufficient clothing and intake, and parents are responsible for this. And children are below 2 years of age comes into this category. And intentional drugging and poisoning is uncommon but lethal type. administration of harm drug that is not intended for the normal use, and parents or those who are severely affected by the psychiatric problem or maybe drug abusers come into this category. And Mangusan syndrome is found in Meadow in 1982. It is considered as a mental illness associated with severe emotional difficulties lead to psychological trauma. Parentally induced illness, otherwise it's called, and below 6 years of age have been affected, and fabricated illness is leading to the unnecessary medical treatment. When you look at the educational abuses, intentionally keeps the child at home or fails to enroll the child in schools by the parents. And neglect is classified as a healthcare neglect, where they ignores the treatment recommendation or the management of any treatable illness by the parent or the caretaker. And dental neglect is a specific type of healthcare neglect where it also leads into the family isolation, lack of finance, parental ignorance, or lack of perceived value. And PANDA, it is prevent abuse and neglect through dental awareness, first introduced in South America. And the safety neglect is one of the kind, and it has the lack of direct and indirect supervision of child to result in an injury. And physical neglect is failure to care or accepted or appropriate standards. And it's all leading to the poverty and parental ignorance. Associated with the physical abuse, the lack of personal hygiene, inadequate clothing, diet, and medical attention. Physical neglect also shown with some pictures, and without giving the children are unclean, unclothed, unfed by the parents, and using them as a servant and not listening to the child. And emotional neglect is inadequate affection, that is lack of mother's care, showing maladaptive behavior and using inappropriate language, refuse to do the needed care. Role of dental practitioners is initially you have to take the proper history, physical examining thoroughly to be examined, and interval examination to be done. It should be documented, and treatment done, parental consultation to be done, and should be reported to the higher ups properly. And April month is called the Child Abuse Prevention Month, and where the team of people will be working up. There are lots of conferences and discussion will be taking the expected category. Dental injuries prevalence in child abuse is a fractured teeth, avulsed teeth, and maxilla and mandible fracture and discolorative due to trauma. And there are lots of child protection agencies are available. First, the police is the concerned authority. The National Human Rights Commission also similar role. Indian laws for child abuse is the physical abuse is the Indian Penal Code 323 and 324. On sexual abuse is girl IPC 376 and boys for 377. There is no law is given for the emotional and educational abuse. And lots of government organizations been there against the child abuse. The United Nations International Children Education Fund, UNICEF, Child and Organization, and National Human Rights Commission in New Delhi. There are lots of non-government organizations also available. Umid Sancha in New Delhi, Institute of Support, Healing and Awareness, Asha Shevapati Shansha and Bay Shakti in Kolkata, Organization for Children at Risk in India, and Spa Seva Sancha in Mumbai. An attempt to prevent child abuse has been started in India by 5th 1996, the Child Labour Prohibition and Regulation Act by Ministry of Law, and which is treated under 14 years of age not to be employed. It is as per the law said. The levels of prevention of child abuse and neglect, there are 3 levels: primary, secondary, and tertiary level. Primary level is an evaluation of child and family situation should be done along with the social worker and healthcare provision. Secondary level will be concerned with the effort directed to high risk group, and tertiary level will be the pedodontic should ensure the child is referred to designated child protection agencies. And so far we have covered the introduction, definition, historical perspective, statistical data, types of child abuse and neglect, and role of a dental practitioner, national policies, levels of prevention of child abuse and neglect. The possible questions are: the essay will be define child abuse and neglect, classify and brief the various types of child and abuse and neglect, and role of periodontics in examining and managing child abuse and neglect. Short notes may be the child abuse and neglect. And this is the version of the child. It took some months just to make me, but it could take minutes to break. Thank you all.